Sydney's health system is under real pressure. At Westmead Hospital in Sydney, 2/3 of intensive care beds are occupied by COVID-positive patients, and patients are being sent to other hospitals to free up space. Ramping of ambulances with patients have been waiting to get into Westmead and Nepean hospitals. Now, what extra resources will the federal government allocate to New South Wales to ensure its health system is not overwhelmed?
The Prime Minister has the call.
Speaker, and I'll ask the Minister of Health, you may wish to add to this answer. Over the course of this pandemic, the federal government has committed and provided some $27 billion in direct health support right across this country to support the very types of measures and challenges that the member refers to, Mr Speaker. We entered in right from the start, a 50-50 dollar-for-dollar arrangement to support the costs that were being borne by states and territories because of the additional COVID-related pressures that they are facing in providing COVID-related medical support through their hospital systems. Now, that is not the normal deal. The normal deal is 45-55, 55 done by the states, Mr Speaker. A long-standing arrangement, Mr Speaker. We made that dollar for dollar because we knew we would have to walk each step of the way with the states and territories when it came to backing them in on the medical and health support that they would need to provide during this pandemic. And I send out a big shout-out to all of those nurses, to all of those doctors, to all of those paramedics, Mr Speaker, and ambulance workers. I know a bit about that. My brother's one of them. And, Mr Speaker, they're doing an amazing job under great sacrifice and under intense pressure, often prevented from being with their families because of the nature of the work that they're doing. And, Mr Speaker, we are backing them in because we've been backing them in each and every day of this pandemic. And not just the health workers, Mr Speaker, not just the hospitals, but we've been backing in the men and women who are unable to get work during the course of this pandemic, and some $4 billion worth of COVID disaster payments being made even now in the course of these most recent lockdowns to provide them with the help and the support that they need. Every single week, Mr Speaker, as we have done now for many, many months, every single week the Department of Health, led by the Secretary, Professor Murphy, does a full assessment of the pressures working with the states and territories across the public health systems of all the states and territories. And that report is provided to the National Cabinet at our most recent meeting. It was a topic of real discussion, as it should be. And, Mr Speaker, as we discussed the various contingencies we would have to put in place with movement of workforces, one of the most inspiring things I've seen over the course of this last 18 months, as we've worked together as a team of Premiers, Chief Ministers and myself, Mr Speaker, is to ensure that we respond to each other's needs. And so you've got Western Australia contact tracers working on the outbreak in New South Wales, Mr Speaker. You've got the same from Tasmania supporting other states, just as New South Wales were supporting other states when they were in difficulty with their world-class systems. So, Mr Speaker, there isn't time for the Health Minister to add, but the government, Mr Speaker, is standing with the states and territories to help them address this very real burden. But we must proceed with the plan.